Hi, I'm Dr. Kevin Walter, and I'm a sports medicine specialist at Children's Hospital of Wisconsin Sports Medicine Program. Today I wanted to take some time to talk about heat illness. Heat illness is the #1 cause of preventable death in high school athletics. And we know that fall high school athletics are right around the corner, and that's high time for heat illness, so we all need to learn about it. Heat illness obviously most commonly occurs when you're outdoors, but don't forget it can also happen in a hot gym or even around a swimming pool. The best medical way to assess for the risk of heat illness is following something called a wet bulb globe thermometer, which most people don't have easy access to. So I think the best thing we can do is look at heat index. Now, most people have heard of heat index referenced on the evening news. Now, heat index is a combination of heat or temperature and humidity. Now, we know that as we exercise, our body temperature rises. That heat index tells us how much we're at risk for the heat and humidity increasing that body temperature to the point where we may be at risk for heat illness. As a sports medicine specialist, this is important because heat illness is completely avoidable. No one should ever die from heat illness. Now, we know heat illness breaks down to a handful of things, but most importantly, it's heat exhaustion. And heat exhaustion will give you the symptoms of nausea, dizziness, fatigue, cramping, things like that. It can also lead to heat stroke, which is those same symptoms, but people will have a mental status change. That means they're getting confused, they're getting disoriented, they may faint. Heat stroke is what can kill you. Those are people that need to be removed from activity immediately, brought into the shade, cooled off quickly. The best way to cool them off is in a bath or a tub of ice water. If you don't have access to that, ice bags in the armpits, in the groin, or around the neck, and 911 needs to be called immediately. These people will die if they don't get aggressive cooling. Some strategies for preventing any type of heat illness include knowing your athletes. Athletes that are obese or athletes that are out of shape are at much higher risk for heat illness. You've got to know whether or not they have underlying medical problems like sickle cell trait or sickle cell disease. Those things can put you at higher risk for heat illness. It's important for athletes to maintain good hydration throughout practice, but also even when they're not practicing, they need to rehydrate. To learn more about heat illness and strategies for preventing heat illness and keeping the kids on the field and safe, please visit our website at chw.org/sportsmedicine.